The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Hi, my name is Patrick Reedy, and I'm an intern with the City of Nashua's Division of Public Health and Community Services. We're here today to talk about Lyme disease with Heidi Peak, the division's health officer, and Abby Mathewson, the New Hampshire State Public Health veterinarian. So, Abby, can you tell me more about the history of Lyme and some of the causes of the disease?
So the black-legged tick is the vector that we have in the Northeast. It's also the same vector that we have in the upper Midwest, where the majority of the burden of Lyme disease in the United States is in those two areas. In our neck of the woods, though, we have a real serious black-legged, formerly known as deer tick problem. The tick has about a 2-year life cycle. It goes from eggs to larvae to nymphs to adults. Within that life cycle, there are 2 different points for the tick to become infected. When the eggs hatch out into larvae, they will often feed on something small, like a rodent or a bird. Many of those are competent reservoir species, and a reservoir species is something that is competent at harboring the Borrelia organism and then able to transmit that to the tick, which then the next time it feeds can transmit it to whatever it happens to feed on at that time. So if it's a human, there's a likelihood that a human can get infected, or if it's another reservoir competent species, it can infect that one too. The next stage that can have that opportunity is the nymph. The nymph stage is the one that we're most concerned about for transmission, though, because they're so small. They're very easy to miss when you're doing tick checks and things like that. And they're also a little bit harder to remove than the adults when you're doing checks and things like that.
Right, because they're smaller. Okay, so you told me that the formerly known deer tick, the black-legged tick, is really prevalent in the Northeast and specifically in our area, right? So is that part of the reason why we're talking about Lyme today?
Yeah, that's certainly part of it. New Hampshire doesn't have a complete survey of where all in the state deer ticks are, but there's really a lot of well-documented evidence that the tick has been expanding its range. So moving from more of a southeast home range and moving out west. And so we're starting to see across the state an increase in cases in areas where we had not necessarily seen as high of a burden as we had before. A study was done between 2007 and 2010 looking at the infection prevalence of adult black-legged ticks, and about 60% of the ticks across the state were positive for the Borrelia organism. We're hoping to redo that kind of work again and adding in some other tick-borne diseases that we have in New Hampshire, all of them transmitted by the black-legged tick. So it's still a continuing area of concern. In the last 5 years, the greater Nashua region has had 1,705 cases of Lyme disease, which is a pretty significant caseload. Compared to national statistics, though, New Hampshire in 2012 was ranked #1 for incidence, and so it's something that we at the state take very seriously in trying to get people to understand prevention measures and why we're still talking about Lyme disease.
Wow, I didn't realize there were so many cases in just our region. So we wanted to get a physician's standpoint on the signs and symptoms of Lyme disease. So earlier today, I interviewed Dr. Granick, who is an infectious disease specialist and the medical director for the city of Nashua. So he's here to tell us more about signs and symptoms of Lyme disease.
Okay, well, the most common symptom or sign of Lyme disease would be the typical bullseye rash that develops usually at the site of a tick bite. It takes several days after a bite for this to show up, sometimes even a week or two. So if you have a little bit of redness and you just remove the tick that day, it's probably more like an allergic reaction to the bite more so than erythema migrans, which is the name of the rash. The rash will slowly get bigger, so day to day it'll look a little larger than the day before. Sometimes that can be accompanied by signs of illness such as fevers, muscle aches, headaches, just feeling kind of run down or crummy. So certainly if you have a history of a tick bite and you're exhibiting those symptoms, you should call your doctor, because if you get on treatment quickly, it's very readily taken care of with a fairly short course of antibiotics. Many patients that we see in our practice will come to us maybe not remembering they had a tick bite. These immature ticks in particular are very small and they're easy to miss. Or if you're bitten in an area that you can't see, like under your arm or behind your knee, you may have missed the initial rash. In summertime in New Hampshire, if you get a swollen joint, that appears out of the blue, that's often very suspicious. You should probably go ahead and see your doctor, because there's tests that could be done both on your blood as well as on fluid in the joint to see if you might have Lyme disease. Also, Bell's palsy, which is a facial weakness. In the summer again in New Hampshire, particularly in a young person, we often find that's due to Lyme disease, whereas if you get it in a much older person, it can be due to other things, viral infections and so forth, or even a stroke in the worst case scenario. Other symptoms of Lyme disease can be really hard to distinguish from other illnesses, so it's probably best, if you're concerned, just to see your doctor, because there's a lot of things that look like Lyme but aren't, and it's important to make the distinction because you wouldn't want to be on the wrong treatment.
Thanks, Dr. Granick. That was very informative. So my next question is for you, Heidi. Can you tell me where and when we're finding ticks in our region?
Sure. I'll talk about where we're finding them in our environment first. Ticks need an awful lot of moisture to survive, so they end up in our environment in grassy or brushy areas, or in leaf litter under trees, or even on low branches. So that's where you're going to find them more often than not. People shouldn't stay indoors in fear of ticks, but they need to be mindful of where they can find them. Ticks display what's called a questing behavior, where they put their legs out in order to latch on to anything that brushes up against them. They'll go up on a stalk of grass to say a specific height where they may brush up against a deer, or or among the leaf litter if they're trying to brush up against, say, a rodent to get a blood meal. When is interesting, and something that people don't often think about, in that we find ticks year-round. Snow cover will certainly cover their environment to some degree, but if we have, say, really warm weather at times, and in the leaf litter underneath trees, we can still find ticks if it's unseasonably warm. Okay. What we need to be mindful of, though, is that nymph season is from April to October, and as Abby was saying earlier, those are the smaller ticks and they're harder to see, and so we see a spike of Lyme disease right during that time and immediately afterward.
Oh, okay. So you're saying from April to October is when more Lyme disease cases are popping up because of the nymph season? Typically,
and that's what we thought Lyme disease season was, that it was a specific season, but it is seasonless because we do see cases throughout the year.
Okay, all right. And so earlier you said, that it's obviously you can't avoid going outside.
Correct, and we don't want people to go outside, not to go outside.
Right, right. So do you have any kind of preventative methods that people could use to avoid getting bit, or how to check to see if they've been bitten?
Sure. An application of 20 to 30% of DEET is effective against ticks, so that's certainly something that people can do in order to avoid ticks.
And that's bug spray.
Correct.
Okay.
Yes, bug spray. Same thing that people would probably use for mosquitoes as well. And certainly parents want to apply that to children, and that can go on to skin directly. But we don't want people to spray it directly into children's faces. If it's a child, it should be applied to a parent's hands and then put onto a child's skin. Okay. And we don't want it on children's hands or near their mouths. We don't want them ingesting the pesticide that's within the bug spray.
Okay.
People should also, if they're in knowing that they're going into areas where there might be a lot of ticks, they want to have light-colored clothing. They want to wear long sleeves. They want to wear pants. They don't want a lot of skin uncovered. And it's a good idea if you're going through the woods and through a lot of leaf litter, you probably want to have your pants tucked into your socks as well, so that ticks are going to be on the outer layer and not on the inner layer where they can hide. Permethrin sprayed clothing is also effective to repel ticks as well.
Oh, okay. And so I think a lot of families are more concerned about how do I prevent ticks infesting my yard. So do you have any tips for the dads out there doing landscaping, trying to keep their kids safe from tick bites?
Certainly, and you have to think about how these ticks are made up and what their ideal environment is. They need to remain moist, so they want to be in the leaf litter and in the grassy areas. So if there are boundaries of, say, gravel or stone around a play yard, the children will be safe in that area, or a separation where the ticks don't want to go, like a gravel boundary in between a wooded area to where the grass is mowed. Keep the grass mowed, keep the brush cut back, and that provides a much safer environment in a yard.
Okay. And so obviously you can take these preventative methods, but it's impossible to stop these ticks from biting. And so how would I check myself, say, after coming inside for ticks on my body? Like, how should I do that?
Well, it's a good idea to take off your clothing immediately after you come in from outside. You can go ahead and wash off your clothing, any outdoor gear, and check your pets for ticks as well when they're just coming in, and make that part of your standard routine. A hot dryer cycle will kill off any ticks in your clothing. It doesn't necessarily need to be washed, but that will certainly kill off any ticks. Showering or bathing immediately after spending a lot of time outdoors is advised. And people can check themselves thoroughly with a mirror and check all over. And if you can't see it, you can also try to feel through your hair as well. But I'll tell you specifically, say on a child, a mother checking a child, you want to be mindful of checking the hair itself, in the scalp, behind the ears, any place where things can hide naturally, underneath the arms, in the groin area, behind the knees, all of those places where, that they're going to be relatively undisturbed.
Okay. All right. Awesome. Well, now I know a lot more how to prevent the ticks. And so if I find a tick, Abby, how would you advise me how to remove it? I hear stories about burning it or putting petroleum jelly on. Is that advisable at all?
Not at all. Those are actually more likely to cause disease transmission than actually killing the tick. So one important thing to remember about ticks is that their mouth parts are barbed. And so like a porcupine quill or fish hook or something, so they can't, if you were to apply a hot match or cover them with Vaseline or nail polish or anything else like that, thinking it'll kill them, they can't back out very quickly. So they're more likely to regurgitate into into whatever they're attached to if you're applying something like that to them, which will lead to increased disease transmission. So the best thing you can do is getting a pair of tweezers, and if you have a tick attached, you want to grasp right next to the skin where the tick is attached and slowly and steadily pull straight up.
Okay.
You don't want to necessarily jerk real hard because that can also break off the head.
Okay.
But a slow, steady pull and remove it. Depending on what you want to do with it, if you're going to be just discarding it, then you can kill it with alcohol or put it in tape or something like that so it can't get away. If you want to do testing on it, or maybe I should more appropriately say identification, like if you want to send it in for identification, you don't necessarily want to destroy it that way. Putting it in tape or anything like that will not be useful for the people doing the identification.
Okay.
But I think Heidi you do identification for Nashua, right? So I don't know if you want to talk more about what your requirements are for submission.
Certainly. We will identify ticks and bugs in general for anyone within the Nashua region. We have a sheet that we ask people to fill out so that we have their contact information. We will take parts. A whole tick is certainly ideal, but if the mouth part is still, has broken away from the body, we'll still try to do our best with it and give people the best identification that we can. We do not test for ticks, and we don't necessarily recommend it either.
Right.
Okay.
Right, which is an important point. I mean, it's there's other. I should also say there's other identification programs within the state. If it's not convenient to get it to Nashua, there's our state entomologist will do identification, as will the UNH extension specialist, and there's submission documents online. But Heidi had a good point about it's not necessarily advisable to try and get the tick tested for organisms it may or may not carry. One, you shouldn't delay treatment if there's suspicion of a tick-borne disease, Lyme, Anaplasma, Babesia, Powassan, any of those. You shouldn't wait for tick testing to start treatment. And two, even if the vector tested positive, that does not necessarily mean you actually contracted the illness, and so then you could be going down a different path than the appropriate diagnosis.
Okay. So obviously there's more information on Lyme disease than what we've talked about today. And so if I wanted to contact you, Abby, or somebody from the state, how would I do that?
We have a main phone line number, 271-4496. We also have a whole bunch of information on our website.
Okay. And which website is that?
You can get to it if you go to our main dhhs.nh.gov website. They have to go through the divisions to the communicable disease control, and then through there to Lyme disease.
Okay.
But we have a lot of information. If you have trouble getting there, you can always call us and we can help.
All right, awesome. And how about you, Heidi? Say I find a tick and I want to ask if you can identify it for me. How would I contact you?
Certainly. By phone, our phone number is 603-589-4530. That will take you right to the Environmental Health Department, and anyone who answers that phone should be able to help people out with tick questions or identification of ticks. And we also have a website, which is www.nashuanh.gov.
Okay.
And if you go to the Division of Public Health and Community Services, you'll find some links on Lyme disease there.
Awesome. And then speaking from personal experience, you can also go to www.cdc.gov/Lyme, and there's a bunch of information there as well. So I want to thank Abigail and Heidi and Dr. Granach as well. And again, my name's Pat. Thanks for watching. The warmer months are prime time in southern New Hampshire for ticks that spread Lyme disease. The City of Nashua Division of Public Health and Community Services would like to remind you to prevent tick bites by wearing tick and bug repellent, showering after being outdoors, and checking yourself and little ones for ticks daily. If you have been bitten by a tick and develop a fever or bullseye-shaped rash, seek medical attention. For more information, call us at 603-589-4530. Thanks.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
The warmer months are prime time in southern New Hampshire for ticks that spread Lyme disease. The City of Nashua Division of Public Health and Community Services would like to remind you to prevent tick bites by wearing tick and bug repellent, showering after being outdoors, and checking yourself and little ones for ticks daily. If you have been bitten by a tick and develop a fever or bullseye-shaped rash, seek medical attention. For more information, call us at 603-589-4530.